Hello, welcome back again to my channel. I'm Dr. Smita, Director Dental Sage, Yelahanka, Newtown. So today's topic is about Bruxism. So what exactly is Bruxism? Quite technical term, right? So it is commonly told as night grinding. Yes. When you ask your better half or your parents, they may be able to tell you that yes, you grind your teeth in the night time. Then how does it matter if you are grinding your teeth? The first and important thing that can happen when you are doing a night grinding of your teeth is pain in temporomandibular joint. This not only affects your TMJ, but in turn can lead to lots of other things like headaches. You can have pain behind your ears. The pain may radiate even to the shoulders. Besides this, there is something called as enamel attrition. There is flattening of your tooth structure, and this probably will lead to hypersensitivity. So how do we treat this? For any such symptoms, if you come across for your partners or your kids, do visit your dentist and they'll help you out. They'll put you for a night guard for a period of 3 months to 1 year, and then this habit can be taken off, this habit can be broken down. For more information and further queries, you can always log into my channel and send in your comments in the comment section and I'll get back to you. This is Dr. Smita signing off for now. Please keep sharing and watching my videos. Thank you.